Good morning everybody. Today we'll discuss about osteoarthritis. This is the first module of osteoarthritis in which we will discuss the definition, types, predisposing factors, pathogenesis and clinical features. In the second module we will discuss about the diagnosis of OA and the rehabilitation of OA. The current image is showing a normal synovial joint. A normal synovial joint will have synovial membrane and synovial fluid. So osteoarthritis is also known as osteoarthrosis. It is a common chronic disorder of synovial joints such as knee, hip, shoulder. It is progressive in nature. It is degenerative changes of the articular cartilage which happens over year or also because of trauma. So the second part of the definition says osteoarthritis is a non-inflammatory. Though the term has itis, the condition is non-inflammatory and it is degenerative disorder of the articular cartilage of the weight-bearing joints. Please understand. So let us understand the difference between OA and RA. Osteoarthritis is a chronic degenerative disorder. The term degenerative is very important. In rheumatoid arthritis, it is chronic but an inflammatory disorder. There is no degeneration. There is lot of inflammation in RA patients. So OA is primarily of two types, the primary OA and the secondary. So when we say primary OA, it occurs commonly in elderly people. It is more common in females and the process of degeneration begins at the end of fourth decade of life. The etiology is not known, it is idiopathic in nature. The secondary OA can appear at any age. It is a result of a previous trauma because of previous wear and tear of the articular cartilage or the joint that can result in OA. So coming to classification of osteoarthritis, we learned about the types of OA. Now we are coming to the classification. So we have broadly two types of classification, the idiopathic, which is the reason is unknown, and the second is secondary. Under idiopathic, we have localized and generalized type of OA. So localized means local to a joint like hands, feet, knee, hip and spine, and generalizes everywhere. Every joint can get affected. That is known as generalized OA. Wherein the secondary type, secondary is, if you go back and remember the types of OA, secondary can happen because of trauma, an underlying predisposing condition. So trauma, congenital problems, metabolic causes, endocrine issues, they can be calcium deposits or any neuropathic arthropathy can lead to secondary osteoarthritis. Now let's see the predisposing factors. The genetics plays an important role in osteoarthritis. So for instance, if the mother of the family has OA, there is high chances that the progeny also develop OA. It is also dependent on geography and environment. For instance, in the Western countries, OA is mostly seen in the hip joint because of their lifestyle. And in the Asians or in the Indian community, the knee OA is most commonly seen. Another predisposing factors are obesity. So more the weight, the more the weight is being loaded on the weight bearing joints such as knee and hip. Age, higher the age group, the chances of OA are more. And gender, we discussed previously that females are more predisposed to develop OA. Activity and occupation, people who uses lot of weight bearing joints like runners or dancers, people who are into squatting more or people who are walking a lot. So such people, those who are using a lot of joint movements can develop osteoarthritis in their later age. Then coming to nutritional and metabolic states, poor status of nutrition can lead to release of or less deposition of calcium, can lead to the early degeneration of the bone and articular cartilage, and the other factor can be trauma. So now coming to the pathogenesis of osteoarthritis. So what happens is the intra-articular structures like the articular cartilage can no longer bear the weight being put on the joint. So what happens is with excessive weight bearing or excessive overuse of the joint, the properties of the articular cartilage and the subchondral bone, they change. So there is early degeneration, there is early wear and tear of the structures, which can cause degenerative changes to the tissues. So we can see pathologic changes in three areas. One is the articular cartilage, the bone itself, and the synovial membrane. So because of trauma or wear and tear, excessive weight, there is loss of cartilage. There is loss of chondrocytes. These are the cells which produces cells for cartilage. Then what happens is proliferation of chondrocytes forming clusters. There is loosening, fissuring of articular cartilage, which in turn break the pieces of cartilage and thereby exposing the subchondral bone. So once the cartilage has been torn, the subchondral bone can be seen. So once the articular cartilage is damaged, the subchondral bone is visible. So the entire weight is now falling directly over the subchondral bone and the surfaces of the bones will rub each other. This will further damage the bony surfaces. How it will damage? There will be death of osteocyte cells and there is increased activity of the osteoclast cells. So once there's a damage of bones, that can lead to microfractures of the subjacent bones. So once there is microfractures, there will be a process known as remodeling. So remodeling it comes in the stage of healing of bones. This remodeling will change the shape of the bone surface entirely. So how the surface is changed? There is flattening and mushroom-like appearance of the articular end of the bone. The surface is rough, the surface is damaged, there is mushroom-like figure. This will lead to formation of osteophytes. So these osteophytes later can break from the main bone and can settle down within the joints in the form of loose bodies. So till now we learnt about the changes seen in articular cartilage and bone osteoarthritis. Those are the two most important changes which we can see in OA cases. Now coming to the next structure, synovium. So in osteoarthritis, initially there are no pathologic changes, unlike RA. In RA, synovium changes are the most important changes rather than bony changes. In OA, we have most of the changes in articular cartilage and bone and very less in synovium in the initial stages. So please remember this difference between the two. In OA, synovium changes very less and does not change in the initial stages. In advanced cases, there is low grade of synovitis and hypertrophy. Also, there could be some amount of synovial associated with chronic synovitis. So, what does this mean? When the synovium is affected less, there is less amount of swelling seen in the patient. So, in RA cases, rheumatoid arthritis cases, there is more of swelling because synovium is actually affected. In OA cases, there is very mild swelling because synovium is not very much affected. So this figure 1 is normal joint and this is osteoarthritis. So the main changes what we see in osteoarthritis even in X-rays is osteophyte formation, and in MRI we can see cartilage fragments, the thinning of the cartilage. So this is the X-ray of OA knee. You can see that the medial joint line of the knee there is no space between the two bones, between femur and tibia. The space has been reduced. And if you see the marking, The sharp bony edges, which is normally not seen in any normal joint, these abnormal sharp edges are known as osteophytes, which is classical to osteoarthritis. Now coming to the clinical features. So in osteoarthritis, the patient complains of pain, stiffness, because why stiffness? There is degeneration of articular cartilage and there is degeneration of the bony surfaces. So whenever the patient moves joint, there will be restriction. There will not be any smooth movement because of the damage to the articular cartilage and the bones. There is alteration in shape. We just read that the bony shape changes. So that is what change we are talking about here. So mostly in osteoarthritic knee, we see genu varum. Please remember this. We see genu varum. There is functional impairment. That means the day-to-day activities will be limited. Simple activities like climbing the stairs, squatting down, walking, running, jogging, or just sitting crossed leg position, there will be functional impairments. Because of inability to do normal day-to-day life function, patients can also develop anxiety and depression because of their condition. These were the symptoms. Now what are the signs? As a therapist, we will observe is crepitus. Crepitus are those abnormal sounds. These sounds are produced because remember, there is formation of osteophytes, there is degeneration. So the movement is not smooth, the movement is restricted, because of which abnormal sounds are produced. Because of the osteophytes and the loose body's deposition, there is abnormal sound which is produced. There is restricted movement, there will be tenderness. In osteoarthritis, specifically in knee, the tenderness starts from the medial joint line. Please remember this. The tenderness classically starts from the medial joint line of the knee. Bony swelling is not a very common feature which you will see in OA, but a mild swelling in more chronic cases, more chronic synovitis cases, you can see mild amount of swelling. There will be deformity because we read that again. There will be muscle wasting and weakness and increased warmth and effusion. So for this module, we have finished our contents. In the next module, we will read about or talk about the diagnosis and the rehabilitation of the OA. Thank you very much.